In this lecture, we are going to discuss the different types of the hyperthyroidism. First of all, we will look at the normal mechanism, how thyroid gland produces thyroid hormones like T3 and T4. Then we will see the different causes of the hyperthyroidism. So, in the normal mechanism, your brain controls the productions of the thyroid hormone. So, if you look at first component that are involved in the productions of the T3 or T4 means thyroid hormone is the hypothalamus that is present in your brain. Hypothalamus produces the thyrotropin releasing hormone. This hormone acts on the pituitary gland. Pituitary gland is also present in your brain. Now, pituitary gland further produces the TSH, thyroid stimulating hormone. Now, this hormone acts on the thyroid gland and this gland produces the T3 or T4. So, this is the normal mechanism how thyroid gland produces inside your body. So, three components involved in it: hypothalamus, pituitary gland, and the thyroid gland, and different hormones produced by uh, each component of this mechanism. So, if the problem happens in the thyroid gland, like thyroid gland itself produces the T3 and T4 without any hindrance in or without any disturbance in the TRH or TSH, then we will call it primary hyperthyroidism. So, problem actually present in the thyroid gland. So, what could be the reason behind it? So, it can be Graves' disease. In Graves' disease, you will see the auto antibodies produced inside the body of the patient, and these antibodies acts on the thyroid gland, and now thyroid gland will become overactive and produces a lot of the T3 or T4, and that condition is called the Graves' disease. Next is the toxic multinodular goiter. In that case, you will see the multiple nodules forms on the thyroid gland. Now, these nodules will produce the excess T3 or T4. Again, this is falls in the primary hyperthyroidism. Next is the toxic adenoma. Single nodule will produce lots of T3 and T4. That is toxic adenoma. And last is the thyroiditis, inflammation of the thyroid gland also releases lot of T3 and T4 inside your blood. So this is all these categories will fall in the primary hyperthyroidism. Why do we call it primary? Because it or the cause is present in the thyroid gland. Next, if the problem in the pituitary gland, then it will be the secondary, because TSH will stimulate the production of the T3 and T4. If there is a disturbance or increase or decrease in the TSH amount, then T3 and T4 production will also be disturbed. So, if the problem is in the pituitary gland, like TSH secretory pituitary adenoma, lots of TSH is producing, then increase TSH means increase T4 and T3, because it will further stimulate. If TSH is high, then it will produces lot of T3 and T4. That will be the secondary hyperthyroidism. If the problem in the hypothalamus, that is a rare case, then it will be tertiary hyperthyroidism if the TRH is in excess amount. So it a rare one. Most common cause will be the primary hyperthyroidism, these one, and in the primary you will see the Graves' disease. So this is how hyperthyroidism will form due to the different condition like primary, secondary, and the tertiary. Next, we will also see the two most important different scenario in which you will see the high level of the T3 and T4. That is the factitious hyperthyroidism. This is artificial, means there is no problem in your thyroid gland, but the person is taking too much medication of the thyroid gland. So thyroid medication will increase temporarily amount of the T3 and T4, and the patient will look hyperthyroidism, not because of the problem in your thyroid gland, but due to the medication that person is taking. Second is the gestational hyperthyroidism during the pregnancy. High level of the HCG hormone will stimulate the thyroid gland, and after the stimulation you will see the high level of the T3 and T4 during the pregnancy. It will also be temporary during the pregnancy. So these are the different cases of the hyperthyroidism. If you still have any question regarding any one of this, you may ask in the comment section. Thank you so much.